There are key concepts that we probably need to understand so that we can move on quickly. One of them is when we say need, what are we talking about? So this is the number and mix of health workers required in a country to address the health needs of a defined population. And usually you look at the health burden of your country to be able to determine that. So demand is actually the willingness and ability of government, private sector, and or donors to pay to have health workers placed in health facilities or other parts of the health system. And when it comes to supply, it's just a number of health workers who are willing to find appropriate jobs given the prevailing wages. So you see that when it comes to supply, you are just basically looking at the training and education as well as immigration, because sometimes we have some people actually moving from other countries come and support us here, and that will be your supply. The demand is usually the fiscal space available, whether in the private sector or with the government. And as for the needs, I've already explained that. But throughout these three key concepts, you realize that there could be mismatches. For instance, you could have produced a lot more than the government can absorb, which is what is happening now. And you could also have a mismatch where, yes, you have produced a lot more, but is this actually satisfying your need? Your need here, you use the WISEN, which is more of a workload indicator for staffing needs. So based on the staffing norms that we have all agreed on, that would be your need. It will surprise you to know that although we think we have a lot more people in the supply chain, we are not meeting our need. But we say we have an excess. So let's talk about the current supply. Mind you, this data is up to 2022. So it has changed a bit. The numbers would have changed as of now. We have not updated this data yet. So this is in reference to as of December 2022. So as at that time, we had 298,382 health workers who are qualified and registered to work. Out of this, more 99% of them were active in the labor market, meaning all these people are actually employed or looking for a job. Only 1% have decided that, oh, okay, I have some education in health, but I'm not going to work with it. So they are out of the labor market. Out of this, as at 2022, per the data, about 40%, actually 39.7% of these stock were unemployed. One finding here, I mean, the 57.9 being employed in public sector, that is good. And then the fact that about 76.5 of them being female. I must say that data, when you look at 76, you are looking more at the nurses and midwifery side, because the dynamics change depending on the profession. For instance, for doctors, you have a little more of the male than the females. And these are all things that we can consider when it comes to policy. Because even with doctors, you realize that when it comes to those who are specialists, you realize that more of the males are specializing more than the female, making us consider whether there are gender issues here, whether we should support them a bit more, because at that time they're also having families and all that. So these are all policy dynamics which you can actually glean from this data. As I said, when it comes to supply, you really need to think about production, education, and there is a little mistake here. I just noticed it after I had sent it. So this number here, the total of the, so the total for the overall application is actually 228,321, and not what has been shared there. So these are the number of applications that is in 2022. Total number from all the other, about 197 programs across these various professional groups. Of these, 55,448 were actually accepted or admitted to the various institutions. This should tell you that the health sector is seen as a very attractive arena to ply a trade. But it means that about 1 out of 4, almost about 1 out of 4, are only admitted to the institutions to actually learn. And this is actually because there are issues with infrastructure, there are issues with faculty, capacity building is needed in that area, even issues with even using technology to expand the educational capacity. And so we realize that although we actually have a capacity of about 78,000, we are actually utilizing just about 71%. These are the average productions per the different cadre.